Assessing hip external rotation is very simple. As before with most of our hip assessments, we need a platform to sit on, like a box, a table, or a bench. And then, of course, a platform or tripod to hang or put your camera on. That's about the same level as the platform that you're sitting on, so you can see direct on images. So sitting upright, facing the camera, camera's running. I want you to, we're gonna test this leg and we're gonna bend this leg to get this leg out of the way. So now my knee is bent, my shin is down there, so I can bring my leg across my body like that. If you have a platform like a plyo box or some other platform you're sitting on that doesn't have this open bottom, then you can kick this leg out to straighten out just a little bit and bring your leg across. But beware, if you straighten this leg too much and you have tight hamstrings, it might force you to kind of round your low back a little bit. So only straighten your knee as much as your good spine posture will allow. So I want you upright, okay? So I'm gonna get this leg out of the way. And then I am going to rotate externally, so that's bringing my foot across my body as far as it'll go, okay? So that's my end test. Now, there's two things that I see people do to kind of cheat on this. The first is going to be lifting up their knee or bringing their knee up and out. So notice that I can get a little bit higher, or it looks like I can get a little bit higher when I do this, but that changes the position of the hip, and it's a fault, and it doesn't count, okay? The other one is going to be shifting and going with it. So as I come to my end range of my hip, I can kind of lean a little bit, and you can see my foot's coming up, and so it looks like I have a lot more range, except because I'm changing my posture here, I'm actually not changing the range of motion at my hip much at all, okay? If you're not sure whether or not you pass this test, save your video, mark unsure on the assessment sheet that you're using, and then feel free to reach out to us if you have any questions.